YouTube, welcome to my channel. My name is Rachel Mayo. Thank you for being here. If you're new to my channel and have not yet subscribed, please do so now. Here's why you should subscribe. I discuss intimate issues that affect us as a society and as mankind. I talk about issues you're going to be happy that somebody's actually talking about. I also review herbal medicine and herbal therapies that one can use to heal the body or boost one's immune system. I discuss remedies that I've used personally, so you will be getting first-hand feedback. And yes, I am an astrologer. I bring you astrology in a simple way that you can understand it and use it for everyday guidance in your daily life. I invite you to explore my channel. I'm sure you'll find other videos that will interest you. Also, remember to hit the bell icon so that you may be notified whenever I upload new videos. Moving on to our subject. How to unblock fallopian tubes, dissolve adhesions, and eliminate painful periods. Did you just get the news about your HCG or laparoscopy exam? Negative news on these exams could be very devastating, especially for a woman trying to conceive. Did your doctor just tell you that the only way you can conceive is through IVF? Did you know that IVF costs upwards of $10,000? And it's not always guaranteed to be successful. Probably scouring the internet and looking for other solutions. Well, you have come to the right place. I have another solution for you to try and have your baby. I suggest you watch part 1 of this discussion. There is more medical information and research on the uses of Serrapeptase. I will briefly talk about the 2 types of fallopian tube blockages. Hydrosalpinx is the type of blockage that is filled with fluid, biofilm, and has mucus plugs. It also appears swollen and has the shape of sausages, which is not the normal shape of the fallopian tubes. The other type of tubal occlusion is the type that has adhesions and scouring in it. I'm not a medical doctor, so my advice is based on the research that I've done and the reviews of people who've also used Serrapeptase. You should always take the advice of your doctor before you use any herbal supplement. Both these types of blockages have dead tissue inside them or biofilms. This is where you see the power of Serrapeptase and its ability to eat away at dead tissue, non-living tissue. So how can you use Serrapeptase to unblock your fallopian tubes, dissolve adhesions, and eliminate painful periods? Studies have shown Serrapeptase to work well in conjunction with antibiotics. They enhance their function. Though they kill your gut bacteria, sometimes antibiotics are the best course of action. At those times, Serrapeptase benefits you by making antibiotics more effective. It weakens the biofilms around the antibiotic-resistant bacteria, making them more susceptible to antibiotics. The enzyme will eat away at dead tissue while the antibiotics clear away and heal any present bacterial infection. Serrapeptase dissolves fibrin, a protein that makes up scar tissue, and emerging research suggests that high doses of Serrapeptase may reduce scarring. I encourage you to do your own research. There is so much information out there about the benefits and uses of Serrapeptase. It is indeed a miracle enzyme. For this enzyme to work, it requires commitment and patience. Give yourself at least 3 months. In some cases, it may require more time depending on how long you've had the condition and the state of your own health. Serrapeptase has been known to work for some people in as little as a month of taking it. Yes, I've read reviews of people who actually got pregnant after taking only 1 bottle. I've also read of people who also took it for the same amount of time and went back and got another HCG and came back with very clear results. I've also read reviews of women who took it for about just 2 months, went for another HCG test, and came back with results of clear tubes on both sides. Both tubes were clear. However, these are not the typical results you should expect. It depends on how long you've had the condition, its severity, and your health. Perhaps you have heart disease, high cholesterol, and respiratory problems. Serrapeptase will target these issues first before it goes to try and heal your fallopian tubes. So realistically, if you're not in good health, I suggest you give it at least up to a year of daily use. So if you're wondering about the size of these pills and how easy it is to take, let me just show you. This is the size. It's very small and very easy to swallow. This dosage is the highest dose. You have to start slowly and then work your way up. 120 SPU, high potency serrapeptase. Start with 1 pill on an empty stomach. If you're going to take another dose in the middle of the day, please make sure that it's at least 2 hours away from your lunch. You can take another dose before you go to bed, but still make sure it's still 2 hours away from your dinner. Each time you take it, make sure you drink a lot of water with it. If you take serrapeptase while your food is still in your stomach, you are going to get violently ill. Please watch part 1 about precautions on taking serrapeptase. Once you tolerate this enzyme, you can cautiously increase your dosage. When you first start taking serrapeptase, you're going to notice a tingling sensation around the area of your fallopian tubes. This is an indication that the enzyme is working and has started eating away at the dead tissue in your fallopian tubes. Serrapeptase will continue eating away at the dead tissue, biofilms, and mucus plugs until it's all eliminated. After this is done, serrapeptase will begin to restore the living tissue back to its functional state. Again, how long it takes for this to happen varies from each individual. It depends on the individual's health, how long the condition has been existing, and how committed they are to taking serrapeptase every day. If you're suffering from tubal blockage, don't waste any more time because you're going to need time for this enzyme to work. And it definitely works. Buy it today. Start taking it right away, and within a few months you're going to see great results. I know it sounds so simple and so hard to believe that a simple enzyme could unblock your tubes. Well, what is in your tubes is mucus, biofilm. All that is a reaction, is an inflammatory reaction from the bacteria. So serrapeptase is going to eat away at that biofilm and those mucus plugs, and all those things will come out through your period. You don't even have to take it along with antibiotics for serrapeptase to work. Just studies have shown that the combination is a very powerful combination. So how does serrapeptase eliminate your painful periods? The enzymatic action of serrapeptase eating away at dead tissues in your fallopian tubes or your uterus will automatically eliminate your painful periods. This is probably the reason why you are in so much pain. Your first period after taking serrapeptase, it's definitely going to be less painful. You might release flesh looking like pieces, so don't be alarmed. You might also release mucus plugs that look like the shape of the sausage-like fallopian tubes. Don't be alarmed when you see that either. This is all just the shedding of all the dead tissue in your fallopian tubes or your uterus. The color of your period might be a very dark red or brownish looking color. This just means that you're releasing old stagnant blood, which is a good thing. So all these clots coming out of you is a good sign that the serrapeptase is actually working. You're going to see a big difference on your next cycle. There will be less days of spotting. The blood will be very bright red, meaning that it's well oxygenated. And there will be less clots in your period flow. And if your periods were irregular, serrapeptase is going to make you more regular. You will probably start seeing your period every month. I'm sure those results will be very encouraging, but don't stop taking serrapeptase at this time. Keep taking it for a few more months and then go for another HCG to see what the result is. You might need to still take it for a few more months. If your HCG result comes back clear, go ahead and try and have your bundle of joy. Please leave me a comment if you've taken Serrapeptase before, and if you use it and you're successful, please come back and leave a comment of encouragement so that other women can start taking Serrapeptase with confidence. I will make more videos about the other benefits of Serrapeptase, so look out for the videos with my lighter hair. When you see that, that means it's a video on Serrapeptase. If you're still with me, it means that you're finding this information useful. I would love it if you share my videos with other women, because this diagnosis can be very devastating. If you would like to purchase Serrapeptase, I've left a link in the description area of this video. So click on that link. It will take you to Amazon, where you can purchase this enzyme, and also you will be able to read all the marvelous reviews that people have left about taking this enzyme. There is also reviews of people showing their babies and positive pregnancy tests. There's so many reviews on Amazon about this product. You can also go to babycenter.com. You will read reviews of people who have actually taken this product, have been successful, and have proven it with clear HCG or a baby. I will make more videos on fertility for both women and men using other products, so please stay tuned. If you're still with me, that means that you're finding this information helpful. I would love it if you hit like and subscribe at this time. Please go ahead and do that now. And also remember to press the bell icon so that you may be notified whenever I upload new videos. I want you to listen to this last part, which contains some of the research that I did. Serrapeptase is a proteolytic enzyme in the trypsin family. Another name for serrapeptase is serrapeptidase. Like other proteolytic enzymes, serrapeptase breaks down proteins into smaller molecules. It can promote healing by reducing fluid and debris accumulation that can occur around tissue when an injury takes place. Today, serrapeptase is mostly isolated from the non-pathogenic bacteria called Serratia E15, which is found in silkworms. Is serrapeptase a painkiller? Yes, but while it can reduce pain, discomfort, serrapeptase works differently than many other anti-inflammatory pain-killing drugs. Research believes that enzymes like serrapeptase work well to reduce inflammation by facilitating immune cell movement and regulating lymphocytes at the site of inflammation. It has been shown to curb inflammation associated with arthritis, neurological disorders, heart disease, injuries including wounds and sprains, sinusitis, bronchitis, fibrocystic breast disease, carpal tunnel syndrome, muscle inflammation, and many other conditions. Inflammation is the body's natural response to injury, autoimmune conditions, or infection. It is a key component of many physiological conditions that may cause pain. Enzyme-based anti-inflammatory drugs are becoming preferred over conventional chemical-based drugs that reduce pain because they generally have limited side effects. In countries including Japan and many in Europe, serrapeptase is currently considered the anti-inflammatory pain treatment of choice. Benefits: helps treat pain and inflammation. NSAIDs are mostly widely used painkillers in the world. They're often used with other medications such as steroidal drugs to treat conditions like autoimmune disorders. NSAIDs work by blocking the production of inflammatory mediators. While these drugs can provide symptomatic relief, they won't work to actually cure underlying causes of disease or ailments. Plus, they can lead to digestive, liver, and renal-related problems when used long-term. Serrapeptase is effective at regulating immune cell migration from lymph nodes to inflamed and injured tissues. Both these are beneficial for bringing back to normal conditions and maintaining homeostasis. This enzyme seems to work in part by breaking down cyclooxygenase. Cyclooxygenase is an enzyme responsible for producing different inflammatory molecules. It can also reduce pain by blocking the release of bradykinin in damaged tissue cells, which leads to a pain response. Lowers risk for atherosclerosis. Certain studies show that serrapeptase has a potential to lower atherosclerosis and heart disease risk. Serrapeptase has fibrinolytic properties. That means it can help stop blood clots from forming. One way it does this is by breaking down the blood clotting molecule called fibrin. Because it can help remove deposits such as those formed by excess calcium, plus fight inflammation, serrapeptase may also be used in stroke prevention. It kills bacteria and promotes wound healing. Thanks to carcinolytic properties, serrapeptase can help control harmful bacteria and prevent infections. Serrapeptase has been shown to support wound healing and wound cleaning. This enzyme is also shown to repair burns and trauma to the skin. It's useful for promoting recovery from infections and injuries because it's shown to 1. Decrease swelling, reduce formation of scar tissue, reduce excess mucus, break down excess proteins, decrease permeability of capillaries, small blood vessels, control histamine response, control skin temperature. I'm going to list 7 benefits of serrapeptase. It helps treat pain and inflammation, helps inflamed and injured tissues return to normal, to facilitate absorption and decomposition products through blood and the lymphatic system. Additionally, serrapeptase has been found to enhance the activity of several antibiotics that have widespread uses in treating infections. These include the types called ampicillin, cycloxylin, minoxidil, etc. The others are just way too difficult to pronounce. Treats respiratory infections. Serrapeptase is used in combination with other drugs to manage infections like sinusitis, bronchitis. This is mostly due to its ability to thin and mobilize excess mucus and fluids from the body. It also supports lymphatic drainage and controls inflammatory responses. Certain studies have found that serrapeptase can reduce accumulation of neutrophils. Neutrophils are white blood cells released from the immune system in response to an infection. Excessive accumulation of neutrophils in the lungs can thicken mucus and worsen symptoms affecting the ears, nose, and throat. 2. Lowers risk for atherosclerosis. Helps stop blood clots, remove deposits, and fight inflammation. 3. Kills bacteria and promotes wound healing. Shown to decrease swelling, scar tissue formation, excess mucus, and permeability of blood vessels. Treats respiratory infections. Thins and mobilizes excess mucus and fluids, supports drainage, controls inflammation, and reduces accumulation of neutrophils. 5. Fights autoimmune diseases. Believed to have unique ability to dissolve dead and damaged tissue without harming living cells. 6. May help treat neurological disorders. Can lead to significant decrease in brain-derived neurotrophic factor and insulin-like growth factor. 7. Treats bones and joint pain infections. Can significantly reduce swelling following injuries and operations. You can read more information about serrapeptase on Dr. Axe's page on draxe.com. If you'd like to purchase serrapeptase, I've left links to Amazon in the description section of this video. Thank you so much for taking the time to listen.